Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our discussions, our conversations around the COVID-19 pandemic. And I'm grateful again for the questions and comments that you sent in to us. Remember, if you continue to have questions and comments, and I hope you do, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Today, once again, we welcome Dr. Dion Vigilance, who's a heart surgeon practicing in the U.S., but he is of Guyanese heritage. He was born here, his parents are Guyanese, and he went over to the U.S. at a young age and has elevated himself to a very successful cardiac surgeon on the cutting edge of technology. And so we want to welcome you again, Dr. Vigilance.
Thank you for having me, Dr. Carpen.
Just like yesterday, we will continue the rest of our conversations by taking off our masks. We are more than 6 feet away from each other, so you do not pose a threat to me under normal circumstances and vice versa. In addition, you also were vaccinated against the COVID-19 virus.
Absolutely correctly, yes.
So we'll take us off. So the next big thing in the management of COVID-19 generally in the world is the development of these vaccines. And there's lots of information, some of it accurate, some not accurate, some designed to help, and some that are not helpful, whether by design or not. You yourself got a vaccine before you came to Guyana. Can you tell us a little bit about that process? You know, what made you decide to get the vaccine? What happened to you when you went to get the vaccine, etc.?
Yeah, you know, one of the things that I decided pretty early on is if there's a vaccine available and the science proves it to be effective with a relatively large population, and I think based on my own information, I have kind of researched about it, it seems to be an effective way to go, I would get a vaccine. And I would not just get a vaccine, but I'll get a vaccine in as much of a public environment as I probably could, to also to educate folks and be an example for them. I think it's hard to ask someone to get a vaccine if you're not willing to get a vaccine yourself.
Right.
And that's something I think is very important.
Yeah, put your money where your mouth is.
Correct, correct.
Yeah. So you got this vaccine, how long ago was it?
It's going to be 2 weeks ago, this coming Thursday.
Right.
It was the Pfizer vaccine. You know, one of the things folks ask about is, well, which vaccine should I take? Or which vaccine is better? Or which vaccine is... And I said, you know, with the pandemic the way it is, the best vaccine is the first vaccine that you get your hands on, you should take, if the science proves it to be effective and safe. And that's really how I approach this. We were offered the Pfizer vaccine as the first offering when it came out 2 weeks ago. And I was one of the earlier physicians to receive that within my organization.
And you qualified for that because you are a frontline health worker.
I'm a frontline health worker and of great risk, basically, on the number of patients, the kind of patients that I operate on. And it was offered to me very early on, correct, yes.
Yeah. So we describe healthcare workers in general as force multipliers. So if one of these force multipliers go down, the ripple effect is tremendous on, you know, the impact that it has on the population, the number of patients affected, etc.
Yeah,
so
that's a great point. I think, you know, in my case, particularly, there are several hospitals that within our organization, and I would be probably the only robotic surgeon doing a certain procedure in those hospitals. I go down, we are not able to offer a patient a minimally invasive operation. They'll get a more invasive operation because I'm not there to do that procedure. That's significant. So, you know, in that case, they will do whatever they can to protect our healthcare workers, not just for me, but, you know, even our ICU nurses. We have a significant limited resources when it comes to our healthcare workers, and I think they have to be protected. And that's why the decision was made to protect them first.
Mm. So the Pfizer vaccine is a 2-dose vaccine. You got your first dose 2 weeks ago. When do you expect to get the second dose?
The second dose will be given 21 days later. I am actually due to get my...
So next week?
Yes, next Wednesday at exactly 2 p.m. I'm scheduled to receive my second dose.
Yeah, it's a great thing to have an organized, structured system so you know exactly date, time, and I'm sure you know the place.
I know the exact location, which room I'm going into to get my vaccine. Yeah, and you know, one of the things that I think with any program like this, when you roll out a vaccination program of this grand of a scale, there need to be a coordinated effort, and there are a lot of people behind the scene making this work. And I'm sure, you know, relatively soon, Guyana will be facing that exact same situation where you're going to have to distribute the vaccine, and how do you go about doing that will take some planning, which I'm sure you guys have already started.
Yeah. So there are 3 major vaccines that are on the radar, Western vaccines. The Pfizer BioNTech vaccine, the Moderna, and the AstraZeneca.
Yes.
My understanding is that pre-production, all of the doses are actually bought up by, you know, the developed countries.
Yes.
We can argue and talk about the fairness and all that. That's not the point of this conversation.
Sure.
Countries like ours, in Guyana, the Third World, the Caribbean, CARICOM counterparts, will have options to get those same big 3, but later down in 2021, maybe 2022. In the meantime, from January to maybe August, we may have the option of the Sputnik from Russia or the Sinovac from China. What are your views on those as options for, you know, the Third World, Guyana, CARICOM, our neighbors?
Yeah, that's a great question. I would probably go back to my initial comments, right? So when the vaccines came out, they were very effective, both the Moderna and the Pfizer vaccine, with almost a 95% efficacy and a very good safety profile. The option was given, do you want to wait on one versus the other? And my kind of thought about this is take the first vaccine available, because that will start the protection or the protective process. Right. Now, the dilemma with Guyana facing, do we go with kind of the, what we call the primary, the brand vaccine, and what's available in Pfizer, Moderna, or AstraZeneca, or do you wait on that, or do you take what's available relatively early? And what I would say is, and again, I'm not a virologist, I'm not an expert in vaccine, but
neither am I.
Good, we're both safe then. So my recommendation on that note would simply be, there need to be a guided focus on looking at the science behind those 2 vaccines and making a determination of what do you think would be both efficacious and safe. And I think that's really what is going to boil down to.
So generally, principle in medicine, safety first.
Correct.
Yeah.
Correct.
And you know, the Chinese vaccine has been used extensively so far across the Middle East, and while we do not have readily an access to the data and the outcomes, there is no report, at least not in the media, where a lot of news make themselves available first, of any mass side effects, any major adverse outcomes. I don't know if you are aware of any of those.
No, I haven't. And relatively speaking, you know, I should say on that note, the Chinese vaccine was actually being used on their armed forces and the military, right? So I always say you're not going to negatively impact those who are keeping you safe and protecting the country. You're probably going to give that to them when you know it's very safe, number one, and it's going to be effective. So overall, the profile of that vaccine seems to be relatively safe, but again, I don't have all the data on it because there's not a mass amount of data available on that, but that's what it seems to indicate so far.
But your general principle or general rule, once it's safe, that you know there's nothing major stopping you from actually taking it, take the first vaccine that becomes available to you.
Yes. I think it is the only way for us to transition to some sense of new normalcy, still having to know that even though you have the vaccine, you still have to prepare yourself to take some of the precautions that you've kind of instituted so far and not just throw the mask away and go about what you want to do as normal. There'll be a kind of a new normalcy, but to get to that point where you start transitioning to that new normalcy, the vaccine needs to be in play.
Yeah. So you were scheduled, you got a call, you went to get your vaccine. how is that process?
Yeah. So basically what happens, there's an online registration process, or when you get there, you can complete the registration form to make sure you don't have any real significant contraindications. And what they're really looking for, in particularly with the Pfizer vaccine when it came out, to make sure you didn't have any significant or severe allergic reactions. And the reason for that is that we've noticed that there have been a few folks who had a reaction to the vaccine. Nothing that actually had someone causing them to die from it, but a couple of people were hospitalized. And one of the things we found out afterwards is that they did not test anyone with severe allergic reaction when they studied the vaccine.
Right.
So that's really what the screening form was for. After you registered, completed the screening form, you went to a separate station where you were vaccinated. Once you were vaccinated, you then went to another station where you were observed for about 15 minutes to make sure you didn't have any reaction. Once you were in that station, the observation station, for that 15-minute period, you actually were prompted to register on the CDC website so the CDC can actually track you, make sure you got the vaccine.
Right.
And if you had any reaction at any point during the course of receiving that vaccine or sometime after, you can then report those adverse events. So that's really what it was about, checking for side effects and also knowing you were registered to receive the vaccine.
Yeah, so that's interesting. You mentioned that they didn't actually test the vaccine before on people with known severe allergies, and it has come out that, you know, if you have allergies to one thing, you may also develop allergies to a second thing, but not mild allergies. We're talking about people with severe multiple allergies here.
Yeah. So really what they, the technical term for that would be, as you know, an anaphylactic reaction.
Right.
So if you're someone that have an anaphylactic reaction to peanuts, or to shellfish, or to any of those things, what tends to happen is that you may have an anaphylactic reaction to that vaccine.
Yeah.
And really that will cause you to have a reaction where you need to go into the hospital or seek medical treatment. For someone with a mild allergy, so I have an allergy to shellfish, and going into that was not going to prevent me from getting the vaccine. I declared that I have an allergy to shellfish, and then really didn't cause me to go through any additional screening. So we're talking about folks with severe allergies and not mild allergies to things.
Yeah. So there are several. Guyana is very good at giving vaccines. We have a really good public health system when it comes to administering vaccines and, monitoring people. Some we take by oral drops, like, in the mouth. Then some are given just under the skin, some deeper into the muscle. Tell us about the Pfizer vaccine. What kind of vaccine is that really? Is that an injection?
Yeah. This one is actually a full injection vaccine, and I can tell you, I get the flu vaccine every year.
The flu vaccine?
I get the flu vaccine every year, and that's been ongoing it's almost like a requirement for me being a physician in the hospital. The Pfizer vaccine is a true injection with a very small needle and a very small amount. It's actually 3 mLs, 0.3 mLs that's actually given to you as a
very
dose.
Small amount.
Very small amount. When you look at the syringe, it's a very, very small amount.
Like an insulin syringe or something like that size?
Yes, that's what they pretty much give it through, with a very small needle. I did not feel the vaccine at all.
You had a really good nurse.
Someone really great gave the vaccine to me, so I asked for a really good nurse. But again, it didn't have any pain the next day, and everyone's a little different. Everyone will have a different kind of experience with the vaccine, but mine was very, very, very easy.
We traditionally think of vaccines after you get an injection, you might have a little fever or something of the sort. Did you have a fever, or did you do anything to prevent a fever?
Yeah, I did not have a fever afterwards, but I must disclose, knowing that I had to operate in 2 days, I did not want to have any discomfort, and I'm not recommending this at all. But for me, I took a little bit of Tylenol prior to getting the vaccine, and I took some Tylenol the night after receiving the vaccine.
Yeah.
Just as a precaution, didn't have any fever, didn't have any aches, didn't have any pains. But yes, the overall sense is that with every vaccine you receive, you may have a little bit of temperature, you may have a little bit of sore arm, you may have little aches and pains, even some body aches. That is not a reaction or an allergic reaction to the vaccine. It is simply just a normal process of the vaccine doing what it's supposed to do inside of your body.
So they give it to you in your right or left shoulder?
You select.
You select, right?
Yeah.
Was there any after pain? Did you have to put some ice on it? We love to put ice on things that is painful.
Yes. No, there was no after pain. I didn't have any discomfort. Didn't need a special rub from my wife or anything like that. No, it was everything worked out perfectly fine. Yeah.
Well, thank you very much, Dr. Vigilance, for sharing your experience and your knowledge on the vaccines that are now becoming available for the COVID-19 pandemic. And thank you very much, our viewers and listeners, for joining us on this program as we continue to learn more and more about the COVID-19 pandemic. Remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again.